Now, we've got people that have participated all through today. You've heard some of them speak to the plenaries, others have led workshops, so I don't think they need any further introduction. We're limited for time, so what I'm going to suggest is that I come and ask anyone from the audience if you've got anything you would like to say, because rest assured, if you haven't, I have. Thank you. We're going to bring you the microphone, sir.
My question, John. Yep. My question is for Eddie Turnbull. You asked us this morning what we could possibly do to help you on your quest. The first thing you could do was to get the track care system sorted out so that it was universal across Scotland. The ludicrous situation where somebody from Highland can't speak to Glasgow Health Board. I'm in Argyll and Bute. You have to go with Highland's instances of track care which don't coincide with Glasgow's.
Can I generalise that then and describe that as systems that work in individual health board areas and you can't communicate beyond those boundaries? Yeah. Would that be fair?
I'll just do one more.
Well, we'll bring about that microphone. Hang on.
And then following that, give the patient control of his records, because it's his records, not the NHS's.
Yeah, and even hers.
Sorry.
Yeah. Thank you. Eddie, that one was directed straight to you. 2 points. Ridiculous situation where individual health board areas can't talk to one another.
Using the same system, but different instances.
And the second one being, when are we going to get person-held records?
Can you hear me okay, or will?
I don't know. Is that working? Yeah.
Can you hear me okay? Just by speaking. Yeah. So 2 questions that I get all the time. So I mean they are clearly important, to me. On the first question about integration of services, you're absolutely right. It's something we're working on. It has improved over the period certainly that I've been responsible for e-health, in the sense that we've got on the one hand, as you point out, moving to similar solutions across Scotland. So originally we had a number of patient management systems in place across the health boards, across the 14 health boards. We now, I think, only have 5 boards that have yet to move to track care. So there's something about rationalising the solutions that we've got there. But then you're absolutely right, it's then about joining them across regional boundaries. So I'm promoting working on a regional basis which does recognise the pathways of care. So there's work that is being done in the east of Scotland, and so following cancer treatment networks, there's been work done there. There's also work being done in the west of Scotland as well. But we are on a journey. I can only say that.
How long? When?
Well, if you asked me a year ago, you would see that at that time we didn't have any regional approaches. We've now got regional approaches.
So next year, this time next year,
I will not be committed to that. But over the next. But I would say, if I had to stick my neck out, by 2020 we should have that regional, all the regional joins in place.
That's no use. People living in Gourock and Greenock who are welders offshore in the North Sea, they immediately go into the Aberdeen Grampian Health Board. It can't just be regional. It's got to. We're smaller. Scotland's smaller than many English.
Yeah, but if all the regions are talking to one another, it kind of doesn't. If you can communicate across health board areas.
Well, you just said that the West region would be talking to.
Oh, okay.
No.
Because there are going to be national services. There are national services around the country.
And just to replace GPAS.
Anyway, never mind.
I never answered the
No, you
second
didn't,
one, which I think is a really important one. So I absolutely agree that the individual is the individual's health record, and the individual should get access to that information. The individual should be able to contribute to that information.
Contribute to that information.
I want to give communicate access to my health.
Yes, exactly. But why don't we? We've seen marvellous examples, haven't we, of other countries like Estonia, where you can access your own health record anywhere in the world, and where you give permission to people to use it, not the other way around.
Absolutely. So I agree with that, and my response will be the same, that to do that in a one-off thing would require considerable investment to achieve that. We have a policy commitment, absolutely, but by 2020, and that's not, it will finally be there in 2020. We have a progression to make that available through to 2020, and we're working at the moment very much on patient summary records from general practice.
Yeah. Now, Lorraine mentioned leadership being one of the challenges that you've got. Estonia evidently did it really quickly because the Prime Minister, or whatever he is, just decided it's got to happen and made it happen. Yeah, haven't we got that? I'll let that one hang. I'm going to take another contribution from the back of the room and then from you, sir.
This is just a backup point.
Can you just shout?
The point that can I just shout?
Well, shout into it is good.
I just wanted to back up Ken's point, because regional solutions are fair enough, but Argyll and Bute doesn't actually get most of its services from NHS Highland, which is what we're a part of.
Yeah, you get it from Glasgow.
Most of our services from Glasgow.
Yeah.
So actually been a slightly different case from a lot of areas, and I think what Ken was actually saying, to get proper efficiencies within the system, it would make a lot of sense to actually look at us across that pathway where most of our services actually come from, because the Highland solution does not work for us.
Thank you. Thanks for that. A good comment. I'm going to bring the microphone down, and then, sorry, panel, you will get a chance. There's an awful lot of you, so you won't get much of a chance, but you will get one. Yes, can we take the microphone along here? Thank you.
Okay. All right. Can you hear me?
Yeah.
Okay, fine. This is following up on the point that Rain said about the 4 barriers: investment, leadership, culture, and skills. And I'm aiming it at Eddie, Lorraine, and Zahid. Health and social care integration is probably the biggest and most, I think, positive change, policy change, cultural change that Scotland is experiencing, and offers an integration of health and social care that is much needed, and brings together the third sector, independent sector, NHS, and local authorities.
Yeah.
What the problem is, on those 4 barriers, it didn't mention, is that the platforms currently used do not follow the patient pathway, and information is not shared. So you can have a third sector agency delivering care in the community who is not allowed to access the NHS or social care system.
Absolutely.
Right? If we're to achieve full digital, outcomes, all right, as has been touted, then I'm sorry guys, we've got to break down those barriers across all the sectors so that true integration can be achieved, but also maximise the service delivery to the customers, but also maximise the efficiencies and economies of scope.
It makes a great deal of sense. I wonder whether I can ask Zaid to respond to that first. I don't think you need it, just shout. It's going to take too long to pass the mic around.
I'm not going to profess to be an expert on this issue, but you're flagging something that people are discussing behind the scenes, but there doesn't seem to be a lot of action around. And I think this needs to be explored further. Health and social care integration is fine in principle, it's something we all support, but these kind of details have to be resolved in order to make it work for people. And the third sector piece is certainly one that seems to be missing in the wider jigsaw. And I think we need to have that discussion and bring third sector more closely into that.
Could you pass that microphone to Alistair Hodgson sitting next to you? Now, Alistair, we haven't heard him speak yet, but he's policy lead, technology-enabled care inside the Scottish Government. Do you have a locus in this field?
Not directly. I mean, that's more around the information sharing aspect, which is very much led by eHealth and Eddie's team. But it's something that comes. It doesn't really matter. I think how you engage with any part of the service. It is something that comes up time and time again. There are pockets of good examples. There are systems out there that do share information. There are, for example, in Ayrshire we're in children's services. We have the Ayrshire system, which which is very good at sharing some of that information if you're working directly with children. But I think it doesn't matter who you are, if you're working in this particular sector, it is recognised as a challenge that we do want to address. The question is how we go about doing that.
Okay, well that ball got kicked firmly into Eddie's end of the pitch there, so let's hear what Eddie says.
I think when I presented originally, I did say that we recognise that as an absolute challenge, and have recognised that for a while. I did say that we've bolstered the team to actually sort of get to the bottom of a lot of this. We've worked very closely with local authority colleagues around this, just even at the, what you might say, the infrastructure layer around Swan, for example, although it was seen, you could see that as a procurement infrastructure. A lot of work went into the privacy arrangements around using Swan, so that when a health board is signed up to Swan and a local authority is signed up to Swan, then the information can move freely and appropriately between the two organisations. We're working with the wider public sector around an information sharing toolkit, which I said previously was there to simplify and punch through some of the obscure arrangements that there are around sort of information governance, because this is not a technology
cultural
issue. This absolutely is cultural.
Now, all the very many years I've been covering this, Lorraine, I've been hearing this culture word. We all think we know what it means, but it seems incredibly difficult to do anything about it. And you've touched on it, that the difficulty of getting people to share this information across their silos. At pace, what do we need to do to dismantle these damaging cultures?
Right. I'm not as convinced it's completely cultural. I think there's a society culture about data sharing in Scotland, and I know it's talk about Estonia, but our society is, as individuals, we're all very protective of our own data, so we do work in a different political environment. So I think culture in the widest sense, it's not just about professionals not wanting to share their data.
Yeah.
I think there is a whole raft of things, but we do need to resolve it so that we can deliver better care. It is one of the things that are some very good examples. Certain areas have managed to make it work. It has tended to be done on a regional basis. At the moment, there's some good examples, but I do think it's something we need to move at pace on. The Health and Social Care Partnerships has given almost a burning platform. We have it in my own area, we've had a Health and Social Care Partnership for nearly 10 years, but we haven't completely cracked the data sharing. We have workarounds, but we don't, and I think a lot of areas have workarounds, which makes me think it's not a completely cultural issue.
I mean,
but we don't have a really good system.
Yeah.
But it is a really, really complex area.
I'm not so sure that as a society, given the right information presented, openly, I am not so sure that we are averse to that sharing. Every time I'm involved in front of what I call real people, their frustration is they have to give the same information to people all the time. They express enormous frustration. I think there might be a bit of an assumption that we all think like the Daily Mail. Tom, what do you think?
I think entirely that is the correct case, because and certainly you've heard Ken obviously here, who's one of our clients down here, and he's desperate to share his information with us.
Yeah.
Time and time again we hear about third sector not being able to share information with us, and our data is how it's produced.
Yeah.
So it's a case of, we know that the health service is putting the information into the system.
Yeah.
So technically under the law, I think they own the data. But nevertheless, this is data about us.
Yeah.
Is that right, Eddie?
No. In the
eyes of the law.
No. Some of the information recorded is clearly recorded by the clinician involved. But make no mistake, your information about you is yours, and you can, under protection legislation.
Try and get hold of it.
Ask to see that.
Ask to see it.
You can ask to get access to that. There's what
Before
you
I
do.
go to other panel members, I want to take contributions from people that
Give
get.
us a chance.
Yeah.
Let's get Nicola in here and say to her, sort it, give us the leadership.
Well, I have her tweet handle.
Because listen, it's easy to say that people won't share, but actually,
Yeah.
you know, I think.
Have we ever been asked? Have we ever been asked?
Let's start one of those public petition things.
Oh, change.org.
It just is my head in because.
Yeah.
Just about, if you don't mind me
Go
coming
ahead,
back in,
please.
just about, you're absolutely right. There was a national conversation around health and well-being where the population of Scotland
Well,
was
no,
asked.
not the population
Yeah.
of Scotland. Selected groups.
Right. But I'm just going to say
Yeah.
that was up at the top.
Yeah.
What you're just saying there is
Yeah.
up at the top
Yeah.
there, that I want everybody that should have
Yeah.
appropriate access to my information. They should get it, you know. So it's there.
Yeah.
That message.
I mean,
was
I
loud
don't
and clear.
understand why anyone would even be interested in how many times I go to the dentist or what vaccinations I've had. What point would they have in that? But anyway, never mind, that's a different issue. Yes, carry on.
So before asking the question, I don't think Estonia is indicative of the rest of the world. I don't think, there are many other health economies where there's a lack of shared information.
I was using it as an example of somebody that had done it quickly and well.
But it's great that there is examples to look at. But I think my question goes back to perhaps to the rest of the panel about the need to promote and mention and promote the digital and tech, because you've got GPs there who perhaps the uptake is not as good as it should be.
Dinosaurs.
Possibly not use that phrase. Use that, not me.
I can.
But what steps and what mechanisms we put in place to try and engage with our healthcare professionals, let alone our
Well,
care?
my response to, I don't know whose question it was, maybe it was Eddie's, about what help, we need your help. What help can we give? And I think perhaps we should be driving this change rather than waiting for GPs to come and give it to our side.
I do think you have to take staff along with you on this journey. They're really important. And I think, obviously I'm an advocate for citizens being involved in this, but I think you can't exclude. I think there's a wider cultural shift that someone needs to take leadership for and bring people along with it.
A lot happens when people start saying, I want this. I mean, Ulf, I was asking him, okay, what happens in Sweden about this access thing? And he said, I don't even recognise the question. We're in this bonkers.
You can't please all the staff all the time, that's the point. But you need to bring them with you, right?
What
Some
happens?
staff think that they're not allowed to share because they've had this big myth in the sky that's been telling them they're not allowed to share.
But
Actually, you just need Nicola to say, okay guys, we're going to do it.
Yeah, I mean,
And we've,
in parts of the states, patients are now, they're exploring patients owning their data, right? For someone to open that debate in Scotland, it would need to be at a senior level. One person, one organisation probably isn't going to have the traction to do that. But if you want to open that debate, I asked the question openly to a senior person. Can't patients own their data in Scotland? They closed me down, saying, no, it's all about processing the information. I was closed down. So if you want to open that debate, it needs to come from a senior person, because only they will have the traction. So it's about actually influencing those senior stakeholders
Can I interject with, there's another cultural difference that I have picked up today, because in Ulf's presentation, I heard you say that your alarm call centre responding thing, I know there's probably a better way of describing it, you take calls from older people and you never complain about that. You never say, do not call us, or that was an inappropriate call. And even you said, even if they say nothing, you are there to take their call. Now, here, I would imagine, we have regular news stories about the inappropriate calls that are put through to NHS 24 or, why do you do that?
Because that's not how it operates here in Sydney, our
Good.
childcare centre. we have a large number of users and a large number of calls every year, and a significant number of calls per user. But then we don't ever regard it as a bad call. We're not doing it on an efficiency basis, we're doing it because it's a support mechanism. The way we measure, our main measure, because I was actually looking at it today, was the number of people who have telecare who feel that it's made them feel safer. That's the measure. It's not about the number of wrong calls. So we do get a lot, and if I give you an example of Joined Up, our telecare is linked to smoke alarms in people's houses. So when the smoke, and it may seem obvious, but it's not there everywhere. So the smoke alarm's tied up. So the first thing that happens if a smoke alarm goes off, it actually goes to the telecare centre. It doesn't go straight to the fire station. And so our operators will try and speak to the person, and we'll say to them, because a lot of older people can put a smoke alarm off by accident, they burn their toast, they don't really want the fire rescue arriving at their door. So what we do is we do almost like a triage, see if we can speak to the person, and the person says, we're fine, you don't need to come, or we don't get a response, and we go straight to fire and say, we've had a call, it's a vulnerable person, we've got the data on the person, and say they're vulnerable. We have got data sharing protocols in place, and that means we know it's both saved a significant number of fire rescue calls, but it does mean we've also got it tied up to our CCTV, so everything can be joined up out of our social work, community wardens, all tied up so that if somebody is in their house and has a fall or is in some way smoke alarm, the whole system's joined up. So that has been done in Scotland.
That's good to hear.
And from Sweden to Scotland, in Sweden it's they link more to the home care, so it's come in to change the behaviour. Where that's where the telecare calls are always answered.
And so I was going to ask you about your system in Sweden, and people are using that in the same way as Lorraine has described, or?
I don't really know how it's used here in that way, but what I do know is that in most markets we go to, we have a tremendous amount of more calls per user than most centers. And a lot of those calls are actually anything other than emergencies or serious actions. It's a lot of social, it's a lot of help for shopping, it's anything that can make you stay at home safe and live independent with help from the home care organization.
So it's an extension of what you've described there then, and it's more preventative than reactive.
Very much. And I don't know how it's in Scotland per se, or in individual centres here. I just know that when most markets we go to, we tend to have 10 times as many calls per user than most.
Because
the most important thing that came out of the Swedish thing was the government told them how they were to go about it.
National
and
protocol.
Everybody had to do the same.
And that was very significant and helpful.
It's been the I would say recognizing the issue in this particular field, which is very far away from information sharing. So but in this particular field, recognizing the issue and then making a joint plan. Where every small or smaller organization doesn't have to understand everything, but get a guiding help. This is a good way to do it.
And we have that here. Do we? Do we have that here? We do. We've got a uniform protocol that we can plug systems into. Alistair Hodgson, sorry to come back to you, but would that be something that the Scottish Government could consider doing, developing this, advising on the shared infrastructure so that people aren't reinventing wheels in local communities?
It's definitely something we're looking at right now. We've actually been in discussion with the Swedish Government for the last few months, looking specifically at how we make that shift from analog to digital, looking at the lessons that the Swedes learned through their process, so that we don't make the same mistakes they did at the start. It's quite good that we have.
Because they've made the mistakes.
It's good that we have the guinea pigs in Sweden.
Liking it.
So we're at the stage now where we've looked at the technical requirements, and our next stage is now looking at the service requirements. So we're not yet at that stage where we're actually saying to local areas what it is they have to do. All we've done is looked at what is technically possible to do, and then what we want to do around that, because there's lots of possibilities. Eddie in his presentation this morning looked at that National Digital Platform Framework, and actually if you then, moving to that digital telecare infrastructure across Scotland, you've then got a route in to this framework for the majority of citizens who are already being supported in one way or another. And that's where we see the possibilities for digital telecare. But we have to get it right. We recognise it's something we do need to do, and there is a time imperative to do it within. But at the same time, we don't want to just be a case of leaving it to every single area to go off and do their own thing.
Because we know where that gets us.
Yeah.
Now, because as I understand it, most of the call centres, like the vast majority, are still analogue. Yeah, or almost all. Yeah, Tom, you know about this.
Well, yeah, actually, I was going to probably challenge you, Lorraine, actually, because I don't understand how you managed to share data between your systems. The current telecare systems, as I understand it, manually deal with telecare systems. The smoke detectors are an item which is an analog device, which is not necessarily always communicating with the base station, and therefore not always you're not always aware that the smoke detector is connected. So that's why you have to send someone around twice a year to check the smoke detector. How do you get the CCTV systems into that when they're not connected to the same telecare system? So if you're doing any connection whatsoever, surely that must be a manual process where you've got one system over here which monitors CCTV, another system over here that's monitoring the telecare system. And that's not necessarily what I would call a joined up approach. And I think that there are much more advantages to using a digital approach in that regard. So I think that it's true that there are steps towards it, but I think what I'm hearing today is lots of strategic vision. I get that. Yeah, lots of that, and I see. But at the grassroots level, I think Eddie even said today that you've still rolling out. That's 100,000 extra telecare users, but again in an analog sense. So in actual fact, we're just kind of more perpetuating the same existing systems. And really what I think the ground floor I'm hearing is saying when can we actually get to a digital outcome?
Right, okay, we've got a few hands going up. I'm going to take this gentleman here, this lady, and then back to you, sir. Yeah. Just shout.
So the Corporate Council, we are our land receiving centre and responder. We are the staff, by the way. I am the person that answers the phone. My colleague over there is the person that runs through the doors, trying to pick them up off the floor and make sure they're okay. I think talking about all the manual processes, the staff are saying this is a real problem. We are telling you that when BG Smith phones us to say help me son, I'm dying, we would much rather spend more time with her than completing all these manual processes. So somebody said about someone senior, well, you're senior. We need you to fix this. You're the people who
well done.
We know how to make these improvements. We know what the benefits would be, not just to our staff, our people, but to the people outside ultimately.
So what's the block? What needs to change?
We need the infrastructure as soon as possible, and we're ready to go, all of us.
Absolutely. Wonderful, and thank you very much for that fantastic contribution. Yes. Go.
I think I want to ditto that.
Yeah.
But if I could also...
You don't have to declare interest.
If I could also say that what we're hearing right now is mass frustration.
Yeah.
I feel it, and I want to communicate it to you. It's mass frustration. We've got health and social care partnerships. We've created those partnerships. They've made them all do it, but they can't even talk to each other.
Yes.
I mean, my God, are we bonkers or what? We need to get this sorted. You can't create a health and care partnership that say you can't digitally talk to each other. Well, what's the point?
Yeah.
Because the person, the citizen at the end of this, and that's another thing we need to sort out. Half of the countries, in the country Scotland I'm talking about, half of the country's talking about patients and the other half's talking about citizens. Create a word. Create a word for seniors. Just create a word called citizens. Why should it be a patient if I'm talking to a GP? And why should it be a citizen if I'm talking to somebody who's in my home picking me up because I fell down?
Yeah.
Get it together. I'm frustrated.
Well, I started my very first tweet was I'd like to see a revolution starting. I think we've picked it
up. Lorraine actually touched on the core issue here, the coalition of councils, 26 out of 32,
Yeah.
a tipping point chained at 10. The fundamental problem that needs to be overcome in addressing all this is back to the Concordat. The Scottish Government saying we'll give independence to each local authority to do what it likes, and hence we've created this postcode lottery of 32 different local authorities doing their own thing. It has then created a very, very difficult environment for government level to take a policy or strategy and then implement it fairly across the 32 local authorities to actually create equal access and a system for all.
Okay.
All right. The other compounding fact on this is not only have you got the 32 local authorities through the Concordat, they can fit the fees of the government, you then got the NHS trusts themselves who are independent organisations.
And then you've got the joint integration boards on top of that.
We've got to overcome that structural barrier and actually say it's not a yes or no, I will or not join this. It's compulsory that all local authorities sign up to move forward in the digital.
Could I just do a clarity on that? There are a small number of councils who have not joined us yet. Hope they will do. But some of them
are they big ones?
One of the councils is already very advanced in digital, and it's just they are possibly feel they've got the scale to move at pace, and they are moving at pace. So it's not necessarily where I would have preferred if they had been part. It doesn't mean there's not a commitment to digital there. It's certainly one of those councils who's moving at pace.
Okay, thank you. Now, we've got very few minutes left. I'm not seeing any hands shooting up looking for contributions yet. So I would like to ask our panel here, now that we've got these leaders sitting in front of us, what do they think we need to do in Scotland now to address what you have described as mass frustration? And it's mass frustration from the people delivering the systems, and I speak for myself, mass frustration from citizens, or whatever you want to call me. Ulf, if you were in charge, what would you do? What would you do to move this on from what you've heard? And I appreciate you've only heard today's snapshot. No.
But I think from my point of view, there are questions here I don't even understand.
Yeah.
and maybe that is also part of the problem when it gets so complex you don't understand them. But there are some things that you can easily understand, and maybe you should start doing them.
Yeah.
So, for example, I know that what happened in Sweden in this case, and that will not probably solve some of the things you talk about. But I think what happened, you could say, is that some part of government really somewhere said that the issue of not going to digital, there are so many other issues we have. You were out there, you saw other issues, and you probably still have other issues. Nobody in Sweden is satisfied with healthcare either.
Well, that's comforting.
But at least they said, one of the problems we have, analog communication devices are not safe.
Yeah.
So you got to change them.
Yeah.
There was a report by the social ministry last year where they said, we're now closing to halfway, but actually that's too slow, and we think the guys that are now not following the policy or the standard we have, we think you're actually breaking the law, so speed up.
Whoa, cool.
So I think that, at least break it down to some and it's very naive for me to try to think I could understand what solves things in Scotland.
But thank you for answering that.
This particular little thing of going on these devices, this communication, because it's dangerous to have an analog, it's dinosaurs, it's old.
Yep.
Just solve that.
Yep.
Just to make a spec for it, tell the alarm centers go digital by 6 months, you can do it easily.
I hope somebody's tweeting all this. I'm too busy at the moment. But Zaid, what would you do? And I hear you saying we've got to take the staff ahead of us and they'll drag the rest of us along.
I didn't say that actually.
I paraphrase. That's how I heard it. Go on. What would you do?
Involve people and talk to people. See how they're living their life and how you can support them.
Is that enough?
No, I think it has to happen in, across the board here. It has to involve people in design services, we've talked about data. Well, actually, let's talk to people about. We've heard this from the audience. I don't think people hear this in the groups that have created the governance arrangements, all the kind of technicalities around it. If you actually just brought people into those environments, that's when they would hit home to the policymakers. Actually, this doesn't matter, and actually, we could design this service better. But that engagement isn't happening yet, but hopefully it will.
Thank you. Alistair, you have the ears of the policymakers. Do you have the opportunity to say to them, look, you're going to have riots on your hands in the streets if you don't do something about this by next week?
5 minutes.
In 5 minutes, yeah. It's something we're acutely aware of, and I know that's not an answer that people probably want to hear. But as I said earlier, we want to make the shift, but we want to get it right. And in order to get it right, we have to actually see what it's like in a real life environment. So that involves like the worst word in the world, which is actually testing and piloting and validating how we actually do this. Because the last thing we want to do is introduce a new technology, a new approach, writ large to everybody, and only to discover that actually it doesn't work and it's worse than what we had in the first place. So we do have to get this right, and that is part of what we have to do at a national level, is set the framework for that to operate within. And that is our priority over the next few months, is to actually get that framework right, so that we can then let the local areas know as to what the timescales are for this, how we're going to go about doing it, what support we're going to provide to local areas to do it, what aspect is expected of them. Because some of it will be like, because you obviously got all these legacy devices which will have to be replaced, which will cost a lot of money. I mean, in Scotland there's well over 170,000 people.
Well, we can build new 4th-road bridges all of a sudden and stuff like that. Why can't we do this?
So that's the challenge for us within government, is how do we finance this? Which is why it's not going to be everybody at the same time. It will have to be a phased approach. But we're getting there.
Eddie, you are a man that can say what has to happen next. How would you head off the riots in the streets?
Okay, it's leadership. I think Lorraine said that. It's about getting that message at all levels in the organisation that digital is better, that it should be, digital is, to coin your phrase, digital is the only real way that we can get a quality improvement and also do things we want to do for the limited funds that we have got. There is a dilemma, and pick it up on your point. I think I have that dilemma all the time. What is best to do locally is against what is best to be done on a national basis. The gentleman's comment about linking everything up, absolutely right. That's fundamental to my job. But
and it
equally,
sounds easy.
we want to promote local leadership, community leadership, and making things happen. So it's about finding that balance. But my final comment would be is we need to change the mindset around governance leadership. I think across the public sector to realise the benefits.
Even across the public.
Public as well, which brings us back to the IGA issues.
Thank you, Lorraine. I mean, if you had your magic wand now.
What would I do? Well, that my budget wanted a huge investment in digital, and we've moved forward very quickly. But we're not in that position, and everybody around here knows the pressures in the public sector, that funding is going down in real terms, and will do. So what we need to do is prioritise and focus in the areas that have the biggest impact in the lives of our citizens, patients, whatever you want to call them. And I realise everybody here are absolutely, I'm speaking to the converted here about the importance. Not everybody is. So what we need to do is drive forward where we can make the biggest. So I sit with challenges every single day about prioritising funding, as do the leaders in your own organisations, as does Nicola Sturgeon, John Swinney and everybody else. There are huge pressures on us all at the moment. And so what we've got to do is make sure we make the case right and make sure that we get that right investment. The first thing is helping people to understand what digital can do and making the business case for it, helping. And that involves hearts and minds. In public sector, you've got to win the hearts and the minds. And in society, we need to do hearts and minds. So it's about not being fanatical and saying we just have to do this. It's about helping understand what the benefits are for our citizens.
Thank you very much. And then Tom.
Well, I can only apply this in a business logic, and as a businessman, if I was looking at Scotland PLC, I would be looking at why I was hemorrhaging cash and where I'm hemorrhaging cash and try and plug the gaps. But also we need to make sure that we have a strategic mindset, we understand what it is we're trying to achieve, how we're going to do it and what the steps to get there. And I think that there's a number of smaller areas, maybe some low-hanging fruit, which can deliver some great benefits if we can only just stop. And one of those is a switch to digital technology within our telecare systems and start to improve the way that we deliver a much more efficient service delivery for our citizens at home.
Yeah.
That's where I would just start there.
And then Ulf,
reinvest the cash.
Yeah, thank you. Ulf, we'd like to.
But just one comment on experience from Sweden in the digitalization and the funding of it. I think Per would agree there has been no cost to the municipalities. The reason I'm saying that is there is a you were early, so you had the experience. But the reason I'm saying that is that average life length of these types of equipments are 5 to 7 years. They're typically replaced 5 to 7 years. The replacement process was put in place was 5 to 7 years. So basically it was said when you start to replace them to digital. Here's the way to do it. And the way, how much is the cost of one person in home care or in assisted living in Scotland, in Sweden? It's big.
Huge.
The cost of this system is about 0.5 pounds per day or less. So essentially there is no funding needed. I mean, it's a rent. You exchange what you have, and there is no big investment for the PLC of Sweden in this.
And actually, business plan.
It's a natural exchange.
We're going to take
for monthly cost.
Why don't we just ask the family or the actual citizen at the other end? Would you pay 50 pence a day to be connected digitally to a call centre? Absolutely, I'd pay £20 a day to connect my mum.
But they're paying even today. In some way they're paying.
Ken wants the final word.
I just want to say,
sorry.
Civil servant there. I sat in committee with Andy Kerr when he was Cabinet Secretary, with Nicola Sturgeon when she was Cabinet Secretary, Alec Neil when he was Cabinet Secretary, and raised these things all the time. How long do you need to reinvent a wheel which has already been invented for you throughout the world?
Thank you very much. On that note, having gone 2 minutes over the time I've been allocated, I would like to do just one little piece of summing up. One is, I think it's really brilliant, and I do a lot of these gigs, to come somewhere where it's so multidisciplinary, where we've got people, leaders of councils, IT folk, health folk, private folk, housing. There's even a pharmacist in the room. So good on you, because I sense that that's a big change. And then finally, please, the pace. We've got to keep this pace. We've got to actually gain pace. And on that point, I'm going to hand over to Tom Morton and say thank you very much to fab contributions.
Well, it falls on me to say thank you all for coming. It's been a fabulous day, and I hope you'll agree. We set out today to try and set an agenda for digital, to try and educate you to what the digital solutions can do, to try and enlighten you about some of the potential solutions that are available, and also to try and empower you to make that change. We've got the example from Sweden. We've heard all the arguments today, and I'd like to thank all of our speakers for fantastic insights into their challenges and the reasons why they believe that this is going to take a bit longer. But ultimately, I think we are moving towards a digital future. I'm delighted to be able to have hosted the event today. I'm glad you all came, and it only says to be thank you very much to Penny for her fantastic chairing of the event.
My great pleasure.
Thank you very much to our speakers, and ultimately for our panel, but ultimately thank you for coming and engaging in what has been a crucial dialogue. Now go out and become digital, please. Thank you.